Good morning. Today is Monday, September 13. We will review distal part of the leg. Today's mother's uncle. Uncle. How do you say your name?
Encore.
Uncle.
Who do you want to raise?
Oh, can we have the back?
Yeah.
Here. Can you see us?
Mm-hmm.
Okay. Then let's be professional from now on. Oh, that's good. That's good.
Yeah.
And then we can bring the bed up, right?
Sure. Yeah.
Would you prefer more lumbar support or more higher?
That's
I don't want you to fall asleep on us, huh?
that's good.
So maybe I start first today?
Yes, please.
Start first. What if I don't know? So we're going to review what we learned last time. I have to do like this.
But can you see Dr. Kim?
Of course, I'm going to go your side. So, what did we learn last week?
Oh wait, Dr. Kim, I'm ticklish.
Oh, you are?
Or like really cold. That's fine. That's fine.
You mean two weeks ago?
That was 2 weeks ago already?
Yeah, 2 weeks ago.
Okay, so we did distal leg. Don't giggle. So this is the proximal part we started, right? Left side of the our home base is tibia on the left side. The bone shadow, you guys can see it.
Mhm.
Oh, you wanna change the gain a little white. So I think I can do that better.
Should I
Yeah.
dim the lights?
Oh, I don't know. Dim the light is better. Then we can have trouble with.
Yeah, I think that's good.
Oh no, this good, but they cannot see your leg.
Or what if we?
I
Jeremy,
can't see it like
can
it.
you
Yeah.
shine the light? That light, like
Or
towards it, image.
No, turn the light on.
No.
Yeah, okay. So I think you guys can see well. No
Yeah.
problem, right? The first muscle you see, tibia is anterior, right? But if I move laterally, you see fascia line, two different pattern. Cursor here. So my cursor is moving. So this is the tibia. This is anterior tibialis. If I move my probe laterally, another pattern comes out. That's the extensor digitorum longus, right? And then another bone shadow is popping out. That's the fibula. So on the fibula is the fibularis longus or peroneus longus. So this is very proximal part. So you don't see extensor, hallucis longus from here. And then as I scroll down, still you see, here you don't see posterior tibialis at all, right? As I scroll down, you see posterior tibialis coming out, interosseous membrane is coming out. But if we wanna remember, thank you. If we remember the nerve part,
that's why
I
it's
think if
hard.
I move like this, I can do by myself, right? If we twist it
Does
this
the
part,
cursor come up on that? Yeah, it does, right?
yeah.
Yeah.
Yeah, I can see it.
Then maybe chair,
Or
please.
down here, bring
The
it,
chair,
bring
yeah,
it back a little bit.
You want to
second
slow it?
Okay, so I'll spend like 5-10 minutes.
Sure.
And like this, so you guys can see now more tibia fibula clearly,
Mm-hmm.
Yeah.
right? And then we remember, for us to learn, because even though I'm an injector for the muscles, you have to know the nerve because we are doing nerve blocks. So just to clear with you guys, there is,
There you go.
I think Amy can explain better now. We have a nerve block, we have a motor point blocks, right? Motor point is the end plate zone. So so when nerve comes from plexus, usually mixed nerve, and then it goes, as it goes down to the muscles, it starts to split. One branch becomes sensory nerve, the other branch becomes motor nerve. But motor nerve, when the motor nerve is piercing the muscle, that point we call the motor point. And then after they pass the motor point, they spread out small motor nerve. And then when small motor nerve ends to the each muscle, we call that end plate zone. So motor nerve and plate zone is kind of similar. So but there is a motor point block, nerve block. But when we say nerve block, it's mixed nerve block. Motor nerve block is almost like a really end plate zone area. But motor point and the end plate zone is almost similar way they use it. So I want you to know. So that's why we have to key on the nerve. But I'm in the about 1/7 or 1/8 from the distal from the tibial tubercle. I think there is some structure status. Can you push it? Can you freeze this one? So if we see here, cursor, you start to some white stuff here, right? White but black dot. That must be the superficial fibular or peroneal nerve. But remember when I drew last week, the sciatic nerve comes down and along the biceps femoris, and then it goes, one goes lateral, one goes to middle. When the nerve branch goes to the lateral, common peroneal nerve. Common peroneal nerve comes down around the fibula head, That is at the time is split in two. One is
Deep fibular.
right. So superficial goes down to peroneal bone, fibula bone, right? And then deep one goes to in between fibula and tibia. There's space. It goes and come to the front. So if you look at it, this is a superficial nerve. Then it's very hard for you to find out the deep peroneal nerve. But for you to know, deep peroneal nerve always move with the anterior tibial artery. So this is anterior tibial artery. Lateral to that is the deep peroneal nerve. So if you don't know well, just to look for the artery. So we're gonna use the Doppler to make sure where we are. Okay. Unfreeze. Now I'm gonna scan down continuously. As you know, there is a moving nerve. You can see on the right side, the fibula. Yeah, good. You can see it. It's here. Where's the artery? Let's find out.
Artery is medial to the fibula.
Yeah.
Right there.
There, that's the medial art. Do you see the nerve is coming?
Yep.
Yeah.
Right
It's
next
just
to
on
it.
top.
Yeah, isn't it beautiful? It's coming. And then now, as I come down, tibia, I'm not so sure his anterior tibial artery. It's usually very round, pumping.
I see.
You see it?
Yeah.
Oh, here,
Yeah.
too big than mine, that's why.
Well,
Much bigger than mine because mine is very teeny tiny. So look at that. So artery is over there. The artery is also coming from where? Popliteal
Popliteal,
artery, right?
popliteal
So that's why it's all coming from the, I'm passing the fibula area, is coming over to the anterior compartment, right? So here, very hazy here, if you see cursor, and then Doppler, not the Doppler, color flow. So that's the artery over there. So if you don't know where is the deep peroneal nerve coming, you found the artery here, you found the artery. So next to lateral to this white stuff is going to be deep peroneal nerve. Okay. So let's go. Then we're going to go down continuously. Anterior tibial artery is coming more clearly, right? You can see it's moving to more to the tibial side. It started from the fibular and then moving. So here, if you look at it, this is the anterior tibialis, and this is the extensor digitorum longus. But still, there's EHL sitting here. But the fascial line is not very clear, right? So whenever I do injection, it's very hard for me to know which is EHL under the ultrasound. So now we learned this anatomy of neuromuscular bundle. So this anterior tibial artery Above that, this is above bilateral. This is the EHL. So uncle is gonna move his great toes. See? Do you see that, right? So where the cursor is the EHL. The facial line is not very clear, but always look at the anterior tibial artery. Once you find out, above and lateral, below the EDL, above the anterior tibial artery and nerve, deeper nerve, right? That area EHL. So uncle showed me one more time. He's gonna push against my, see, that's the EHL. And then move all toes. So above, actually he's moving his great toes, but just move these toes. See, you can see, this is the EDL, this is the EHL, this is anterior tibialis. Anterior tibialis looks like two muscles, but
I was gonna say, that
in
looks
the,
like, yeah.
if you look at it, I think it's gonna be the central tendon.
Okay.
So we're gonna go continuously,
I think this whole part is.
right, all of them.
And then are we seeing
Above, below is all anterior tibialis, okay?
Are we seeing posterior tib down?
Yeah.
Yeah.
Posterior tibialis, I'm gonna change the depth. So now we're gonna go next to one. So there you can see nice square one on the
Yeah.
top. And then Encore is very great model. This is the fascia line, which is interosseous membrane.
Okay.
Interosseous membrane. And then underneath is all of them are posterior tibialis. But I think Amy, you have experience. If your needle go, even though when we do the posterior tibialis and muscle injection from the front, we go out of plane, right? You
Yeah.
put the needle
You
like
pop-
this,
yeah,
but
you
if
pop
you
the
put
tibia.
the needle go too close to the tibia, actually you have a chance to hit the flexor digitorum longus. If that is very close, because look at this, to tibia and then the flexor digitorum longus is over there. It's a posterior part, so you can hit the tibialis or flexor digitorum longus. Okay, so make sure that try to put in the middle of the posterior tibialis, not too close to the tibialis anterior, and then I think that's what we. Then you can still not see the anterior tibial nerve, but this I assume that this is anterior tibial nerve. Okay, I'm sorry, deep peroneal nerve.
Deep further.
Deep peroneal nerve because it's next to lateral to the artery,
Tibial.
and then you can still see superficial peroneal nerve is moving. So it's gonna be let's go come from the lateral side to see, because actually we never follow through that one. If I move, so here, let's from here the. I did it. Sorry. You see nerve over there. That must be more tibial nerve. I'm looking for your fibular.
I see it. It's like after the right.
Coming along above, can you use the cursor? This one, right? So you guys see this one? This is the common peroneal nerve because it's around underneath of the fibular neck. So I'm gonna go back to show you. See in the now skin level.
Yeah.
See? You see it?
It's so superficial.
Very superficial when it comes to the fibular neck. Do you see it, right? I'm gonna, in case they don't see it, that's the common peroneal nerve. Okay, I'm gonna track down. See, do you see it?
Moving.
The
Yeah.
moving. So I'm gonna show move like this, like that, like this.
Yep.
Just follow the cursor.
We are that off.
This
Yeah,
one,
it's pretty-
this one coming down here. Splitting. I think the ice is splitting here. One this.
Yeah, let's go
You
peanuts.
see
Yeah.
it, right? Two picture,
To go
let's say.
proximal and
Yeah.
then we'll see coming back together.
Do you see it? Oh, I'm sorry. Cursor. here the nerve superficial common perineal nerve was coming from here and going above below the fibula neck and below, and then I see splitting 1 and 2 dots, right? So let's see. The superficial common perineal nerve coming already splitting over there. Look, look, look. You see 2 beautiful 2 dots?
Yep.
Wow. Can you freeze?
I love it.
Do you guys think I'm a little fun?
This
We are learning together, so look at this.
This is the enthusiasm we need.
Dr. can calm down. But anyway, look at this cursor.
Beautiful dots.
So here 2 dots, right? And then we are underneath of the
It's a ladybug now.
he's tickling ladybug. Oh, my uncle is dying. See, I see 2 very together. So 1, look at this, 2 is moving. Why don't we change the depth, right here? Wow, there we go. So you see 2,
It does, even has a little smile.
right?
Yeah.
Oh my God, yeah, let's just smile sign.
Yeah, it smiles.
Smile sign. Oh, can you freeze? Make sure we know smile sign.
It's like Charizard.
Is this the
Yeah,
smile?
it does look like
I
Charizard.
don't know, this is
Yeah,
smile
I
looks
remember
so
Carl
like a,
Okay, look a little
Curling
Looks like a
over,
ghost.
curling over the fibula.
Or
That's all.
Casper the Ghost.
I would
Yeah.
agree with you.
let's say measure. This, I'm gonna show where we are talking because you guys don't see, this area we're talking about. We all agree? Oops. Right?
Yeah.
So here you see 2 eyes.
Yeah.
Nose is like mine, no nose. I went to have new glasses, and then the lady was asking, "Where's the nose?" I said, "I have no nose." Okay, clear. That's what one of my patients told me that. I said, "Look at my nose, finger to nose." He said, "Dr. Kim, where's your nose?" I said, "Oh, I cannot find it. See, look, 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 moving."
Yeah.
The deep peroneal nerve is coming around.
Drop
So
it down.
still very hard, right? Here, you see, here?
Maybe losing a little bit, but on the.
Yeah, that
there.
one, exactly. Uncle and I have the same eyes. This
Front
one,
is going
Yeah.
forward,
yeah,
right?
it's going down. Then here is better because it's scan away. We are going down, the artery is here. This is the artery, we saw it, right? So now, if I go up, you see there's a little bit of a moving. Here, this area is nerve is moving. Artery is downstairs here. So we kind of now clearly know where the deep peroneal nerve, superficial peroneal nerve. Then let's go down continuously to look for the peroneal nerve. Let's study peroneal nerve. So peroneal nerve is going to be above the fibula. You see that one moving, right? So moving. So it goes to the superficial branch too. See, there are two moving. One goes to the more superficially. One is here two. Do you see two? Another 2 things. Here 1 and 2. I think this is a superficial branch. See, it's moving up. Here, one is here, right? Then it gets smaller here. But the superficial peroneal nerve to the muscle is continuously staying on the top of the fibula. So we go continuously like this, you see, still here, and here. And peroneus longus, now look at this, I'm in the middle. Peroneus longus, peroneus brevis. Coming down. So the longus is getting smaller, brevis is getting bigger. So by the time I go to the ankle, not ankle, or ankle, here, by the time I go here, we continuously looking at the,
So the peroneus longus is pretty much entirely tendon at this point, right?
so only longus become tendinous, and then brevis still muscle when it
Yeah.
comes to the ankle. So look at this, almost peris longus is, sorry, sorry. Here now what I'm gonna try to show sural nerve with this one. So if you twist your leg a little bit, let me find out if I can find it. I used to find it. So this is the lateral malleolus. This is his Achilles tendon. Between Achilles tendon and lateral malleolus,
This is peroneus.
there's peroneus brevis. This is peroneus brevis. This is Achilles tendon. I see here nerve.
Mm-hmm.
So we're gonna put the
This might be your plasma bridge. Because you're going through two hard structures. I wonder if a gel stand-up will help us.
Oh, yeah.
what do you say? Put gel more?
Yeah,
Yeah.
because
In between
if
the
you,
two.
like almost like a
Because
standoff because you're going between a
Yeah,
hard,
because
two
it's
hard.
too much. So let's get rid of this one first. One is
I feel like I see it in between the vasculature there.
Yeah,
It's tough to
it's-
see.
It's so
Really,
weird
really
because
tough to
it's
see.
usually easy to differentiate the.
If you go a little fast.
Oh, that one.
Yeah.
I see it now. Here, if you
Yeah.
pay attention this part, see,
There it is.
it's
Yeah.
moving. See
It flattens out pretty considerably.
here, and then about 14 centimeters from the lateral malleoli, just like when you guys do EMG.
That's what we're
We
doing
put
now.
the probe here, right? So that is here. You see, very, very superficial here.
We actually, when we actually get the
Oh, here, here.
stimulation.
Do you want me to steam him?
No. I know you can. I know you can. So I know that we have the medial and lateral. With the medial and lateral contributions to the sural. When we get stimulation points, it's very common. We get a lot medial posterior. And I think we stim it, and we're so far proximal that through the communicating branch, it comes back down towards here. And then we have our active in our recording electrodes here. So I think right here we're looking at the most lateral aspect of the sural nerve.
Actually, that's not really true. Lateral, the common peroneal nerve gives a lateral branch.
Right.
Tibial nerve gives a medial branch. They meet over here, and it becomes all one sural nerve. So that's what you are trying to say.
Yeah,
Because
I'm
it
looking at.
comes with the two common peroneal nerve and then tibial nerve like this. It goes. If you track down, usually it's about proximal 1/3 is splitting. Two.
Okay. And they
It's
join.
not here. So 14 centimeter when you do the EMG, about from the lateral malleoli, you usually put 14 centimeter here. Oh, here I see it. This one. You see moving?
Yeah.
I have to do like this. See? It's going to almost skin and fat area, right? So coming down. Yeah, good. Thank you. So you clearly see it here. See?
Yeah, it's very
This
ovoid.
one, this one. I have to move it. So look at this. You guys doing EMG, put the electrode, you are here. I used to, when I was registered, always measure the lateral malleus 14 centimeter. I put the, see?
Yes,
It's
there it
moving
is.
very nicely moving. Oh my God, you're the best, mother. See, see?
Actually, you probably see it defined on the.
Look at this
Small footprint.
continuously. Yeah, that's what I was thinking.
That one was
Did you
from
read
the-
my mind?
I don't know. We always scan with this one.
It's so funny, but we don't want
to.
to change it. Can I have a hockey
Yeah.
stick? Yeah. That's when we do course, we use that one. It's been a while because of
Yeah.
pandemic, you know.
Hit the button. This one? Yeah.
Yeah, just change it.
I think this is nerve.
Oh, that's why I couldn't see well actually. The reason why was it was a hack. See here, look at this.
Oh, wow.
There you go.
So now you see this left side of the screen is the peroneus brevis, and then Achilles tendon is the white stuff. on the right side, right? In between, you see the sural nerve is moving.
There it is.
Mhm.
We agree that this is a sural nerve, right? So,
Oh,
am
they
I?
don't.
Oh no, I'm sorry. What am I saying? This
Yeah,
one.
the honey.
Yeah.
You can see very
This is the
honeycomb
vascular,
shape,
yeah.
right?
Yeah.
So it's next to artery here. See,
Yep.
artery,
And vein.
vein. In
Right.
between, right? In between artery and vein. Let me just wait to show the artery here, right? So if we freeze, what's the name of the artery? Posterior tibial, I think posterior tibial artery coming down. Posterior tibial artery. Can you find out?
The
Okay.
posterior tibial artery is on the medial side.
Yeah.
Oh yeah, sorry, we're on the meeting.
I got it.
What artery is this? That is the posterior tibial artery.
It's not
No,
posterior.
no.
Oh no, fibular.
Lateral.
Is it the plantar artery?
Plantar. It could be the plantar artery.
No, plantar should be the opposite side. Hold on.
Guys, wait 1 second, okay? We are working very hard at this time. Oh, I cannot do because it's in my table. Here. I was studying.
Is it the perineal artery?
Oh, that's the saphenous vein. See? Saphenous vein
Doesn't saphenous.
and
Saphenous
sural
vein.
nerve. Saphenous vein.
No,
Saphenous medial.
saphenous
Medial.
medial.
Right? Saphenous vein.
Medial.
Saphenous is medial.
Medial side.
Oh, I put the wrong
Saphenous
name then. I didn't publish this one yet.
We are learning.
Yeah.
What is this giant?
That's weird. What can you?
Nothing is labeled, like here.
It goes to
Yeah, saphenous is medial. What am I saying? Because I was doing media and then I typed over there.
Is this showing up on the app? Can we look at the
And
app?
somebody will laugh at us, but we're gonna find out, okay? Jinpu says less saphenous vein. What? Less saphenous vein.
Saphenous?
That's not the sap.
It's the lateral malleolar branches of the perineal artery.
Yeah, because you remember perineal
Yeah,
artery is
Perforating perineal artery
So
and
pop-
just lateral branches.
do you remember popliteal artery splitting into posterior tibial artery and fibular artery, right?
Right.
So fibular artery is coming
It's a
laterally.
fibular artery, yeah.
Yeah, laterally, so it's gonna be fibular artery.
Yeah.
But what branch? I'm sorry,
Just lateral perforating branches. They're not.
lateral perforating branch of
It's
fibular
the-
artery.
Oh, something's going down.
That's her foot.
I'm sorry guys, we are having too much fun. Okay, so that's the branch of the fibular artery. Jinpu, what did you say? He's participating us. That's what he
Here,
says.
Dr. Kim. There's the fibular artery, and then there's a calcaneal anastomosis that form. Posterior tibial artery,
Yeah.
but that goes medial,
He said left is not gonna be.
and then fibular artery
Right.
is right there, and then you have this calcaneal arterial anastomosis that forms.
So that's
I
the
think it's
branch
the
of
fibular.
the fibular artery.
Yeah.
And the vein. So I want to know, there are two vessels, right? So artery is going to be more fibular side.
Yeah.
So in between, so muscle side, the peroneal muscle, between here, my question is,
So like.
this
right.
is a fibula, let's comment. Peroneus brevis, right? This is peroneus brevis goes here, this one. And then this is what artery? The
Tibial artery.
Fibular.
fibular artery,
Yep, just like that. So
right?
peroneus brevis.
Then this is the fibular vein. What's the name of that? This in the middle is the
Sural nerve.
sural
Well,
nerve.
actually, there's a small saphenous vein that goes on the left side.
Sumal saphenous vein.
Yeah.
Also, I was right, saphenous vein.
On
I
the
said
lateral
saphenous
side?
vein.
Yeah, apparently. So the pyramid
Yeah.
is a great saphenous vein that's on the left, and there's a small saphenous vein that's on the left. On the
So
on the
artery
left.
wise, fibular artery, vein wise is a saphenous vein. But
Small,
tell
small
me,
saphenous vein.
Prince, which one is the vein?
Prince.
Achilles tendon side or?
I think if we put the if we just, let's see what's actually.
So look at this. No.
possible.
Princess Dr. Kim studied. Look at this. I wrote here. Vein is the fibular brevis. Part is this is the vein. This is the vein, this is the nerve. So it must be artery here.
Yeah, or if we put it back on, we can see what's compressible.
Guys, we're gonna cancel this label. Let's cancel clear. Oh,
And then
Alright, Jim,
Can we
go
track,
up.
Okay.
Dr. Kim, can we track Sural nerve from the
Yeah,
left
yeah, yeah,
line
we're gonna
all the
do
way to
that.
the-
Jimpu, you figured it out. Can you
Yeah.
let us know,
I wanna see the
Jimpu?
joint.
We love you. You have a time to study.
You're getting excellent feedback from your audience.
What
Jordan,
did they say?
Jordan texted, said, we are doing great camera work today.
Oh, really?
Yeah.
I figured that out, guys.
Yeah, we
As the
will-
camera
we'll
is
make the
not on
last
his
round.
leg.
Okay, so I'm gonna show up one more time. Fibular. This is the fibular peroneus brevis, right? Long. Oh, this is good.
It's nice.
This is the longus, right? This is the longus. This
And
is
then-
brevis. And then I'm gonna move my probe to the Achilles tendon side. I'm gonna change the cursor so you can see better. Not cursor, gain. You can see better here. There's Achilles tendon coming. So this is too much for you guys to figure it out.
what's
Look at this. I'm gonna freeze here, right? So cursor. This is the fibula, the peroneus brevis. This is Achilles tendon. This is supposed to be nerve. This is supposed to be, we don't know, artery or vein.
Vein,
For me,
yeah.
vein, saphenous vein. The nerve or artery, but he's gonna figure it out. Oh, this one's so small. But we're gonna figure it out now. We're gonna go, let's
Can you
see.
compress it? See which one's the vein.
Oh, yeah.
You guys are telling me what to do
Already
too
you
much.
can see the medial line.
Can you see it?
Oh,
Yeah.
so also we can compress.
Yeah. There you go.
Yeah.
That compress,
That's your
that's the
vein.
vein, saphenous vein, that's the
medial,
artery.
Yeah.
So in between the nerve. Oh, now it's clear when I compress down, right?
Good.
So this one is compressible, so that's saphenous vein. And then artery, where the artery disappears then? There's no artery?
No. Right. Popped up.
The artery's on the right.
Yeah, that's,
Right
No,
there.
I compressed. So that's vein.
No,
So that's
no.
nerve. See, that's nerve. So
that's
look at this.
right here.
I'm gonna phrase what we are talking about. They may be curious about what we are talking about. This was the vein area, compressed.
Yeah.
This is the nerve.
Yeah.
But there are two vessels, right? But when we press down, it all disappears. I should study before I do, but apology.
Can I get on the
See,
Doppler?
look at this.
Or the flow, yeah.
Yeah, let's put the Doppler. They may be both a vein.
It looks like you see a much thicker wall on the right side.
Yeah.
Yeah. That's why like this one looks more artery.
It's pulsar. Yeah.
Or we can do Doppler, maybe. Actually, no.
I think this is artery. That's
Oh, now it's coming. Ding ding. Okay, thanks for. It's Jimbo. Okay, what did they say? Jimbo, we tried to read you.
There you go.
What did it? We have that one too.
There you go.
So
There you go.
just small saphenous vein here.
Small saphenous
So
vein.
it's two vein. I guess this is the
So they're all
nerve.
vein.
Nerve. Yeah.
No artery?
Anastomosis.
You probably don't get the artery.
Yeah,
It
but
doesn't
there's
look like it. The artery is pretty deep down there.
Because
it's
it-
like between the fibular brevis, or peroneal brevis, and the peroneal, like the lateral malleolus.
So maybe I was right because only nerve is the saphenous vein
On the left
only.
of that?
Saphenous vein only.
Does it matter?
Oh yeah. So I can see it. No,
Oh.
yeah, perineum.
Because when I studied, there was only vein, but I was curious why only vein. But now you
There you
said
go.
very deep. Artery is very deep.
That's what it looks like with the film.
Right. So the sternal artery there.
Yeah. So here's your cervical nerve.
So
Here's
we're
your
looking
vein.
at these two branches right here, right?
Yeah. Kind of. Yeah.
Now very clearly nerve together, three
Yep.
things. But can anybody put the color flow here? And then that's the only vein. What is this? Yeah, two veins.
veins.
Two veins. in between two veins, and then moving. Okay, now, so we'll figure it out after this, but look at this, and then we're going here. Now nerve will become very clear here, honeycomb shape in between dark, too dark, right?
And so we are in full on, this is true sural nerve right now, right?
Yeah.
We're not
Not
proximal
the
or lateral.
proximal. So
median.
let's track this one down, okay? Up, track this one up. Sural nerve, sural nerve, sural nerve. Very clear here, right?
Yes.
You can see honeycomb shape. And go,
Thank
go,
you.
go, go,
I work
go.
on
Oh, you work on it? Now I'm going over there. I'm keep twisting his leg.
Yeah.
Now it's going here, yeah. I'm gonna go down again.
Yeah.
Here, you guys see it?
Yeah.
Almost skin, right, already? I'm going up,
We agree, it's right here.
yeah.
Yep. Amy, can you use the arrow to help guide the
Here. I should put in the middle. This is in the middle now. Here.
Can you track back down and up?
This is the nerve. I'm gonna track down so you guys can see back now. It's
Yeah,
moving.
better enough, see?
It's moving. It's moving here, here. Okay. Maybe, oh, that's better. Right, this one? I have to go a little medial side.
Oh yeah, I think he's got to lie on his stomach.
Yeah, he has to, but he has to see. Oh, maybe twist your body like that. Because then we can go from
When we
here.
get when we get in the EMG lab, I feel like I'm almost over here.
No, you usually go lateral.
Yeah, but when we stim, we're.
That's too medial.
Yeah, I know.
Oh, so look at this. Now you may find out better then. So here, let's go from here. Okay, nerve is there, right?
Yeah.
I'm gonna put it in the middle nerve. The cursor.
We did the scan a couple
This
weeks
is
ago.
the one, okay, guys. Follow the cursor.
This is a good
Now
one.
it's going to the fat level. You see here? Now it's going to the fat level.
What is that slip on top? Go back down for a second. This one?
Down.
That slip right here.
Something is
that's
a-
coming. That's the vein just slipping across the top.
Yeah,
Okay.
that's the vein that we saw
Yeah.
before.
Okay. Got it. And now we have the nice sural.
So sural nerve is in the middle, right?
Yes.
Middle.
We use the mouse pad to track it. Would it be
Not
better?
that one, this one. Yeah,
This
that
one.
one. This one. But you can still see, right?
Yeah. But
I
if
tried
you
to
go,
put
we
it
can,
this
but
one
I
in
don't
the
know if
middle.
people back home
if
can.
you go
This
up and
is
down
this
real
is
fast.
this is the nerve, okay, guys. This is the nerve. See, I'm coming down. Look at that one, okay? I'm coming down.
We still make it out pretty well.
See?
Yeah.
You can
Now
see
it's-
it. Yeah. Now you guys you are familiar with this nerve, sural nerve, sural nerve, sural nerve. So I'm kind of Achilles tendon, almost in the middle,
Yeah.
middle of the calf. Twisting. I don't know. Uncle is gonna go where I don't know.
And then there's that communicating branch. No.
Is this two already?
That's one still.
Still one, right?
Yeah.
Because it,
But
I,
can
know-
you go up
I
and
think
down
it has
a
to.
little
It
fast?
has to go here. I
Yeah,
still
it's
here.
splitting.
Looks like splitting here.
It's splitting.
One and two.
And then is that the communicating, the distal communicating branch?
Where is the branch? You keep saying.
It looks like it almost looks like it slips right up.
It has to go a little higher level.
Yep.
See now, still I see one.
Communicating, right? Yep.
Yeah.
So how
Par-
what level?
Communicating goes more lateral or more
Here.
medial.
It connects the two.
Yeah.
I see two here. Look. Can you freeze?
Oh, sorry,
That's okay.
didn't
No,
notice.
you can still move. Oh, once you hit the
Oh.
cursor. Okay, I'm here still. Can you unfreeze? Here. See two? You
Yeah.
see it?
Right.
One, right? Oh, still two.
Two.
Two. It's meeting.
It's coming.
That-
There it is.
going.
Not
away.
still
Yeah.
two, right?
No,
Now
I
looks
thought
like
I said
one.
one.
Looks like one. So this is only half. A little. Maybe Gerard is right. See, look. Now we see two, kind of.
So this is the diagram I have that I'm referencing.
Here. Looks like a two.
Because
Now two. Clearly two to me here. I don't know.
What was that diagram, right?
That looks
yeah,
like
yeah. So you have
Show me.
the medial coming off of the
Oh, it's on the
tibial.
computer.
I'll take a
There's
picture and
still
then
one
show you.
here. Is this two is moving? This is almost common perineural nerve eye, and
This shouldn't become like a lateral medial, so continuous there.
So you have, after the sciatic division is the tibial and fibular. You have the medial coming off of the fibular, lateral coming off of the common perineum.
Common perineal.
And so these two join up in the back. That's why when you stim, you're stimming the tibial division, the medial sural, and you're recording between the lateral malleolus and
So-
Achilles tendon.
they merges at the ankle level.
Distal 1/3, which is where you, I
Where
guess,
we are 14 centimeters. So, okay, let's start
Yeah,
from here
'cause you-
again.
I think when you stimulate 14 centimeters, you're still over the medial portion. So that's why when the EMG, every time we can't get it, the EMG techs come in and they just go really deep and they press hard more medially than we do. And so initially I didn't understand why. But this is good
Now
practice.
we are in the still skin, right?
I think this is
Do
one
you
of those
think
things
this
too.
is already two? Then here?
It still looks like one. I think it's just the vessels, architecture, and then the nerves in the middle still.
Okay, we know exactly what is Sural nerve now.
And aren't there, isn't this one, Jeremy, did we go over this one in the EMG lab with variants,
Was it Sural now?
where it's at different contributions?
Is this
for the-
two?
Oh, the
now?
fibular perineal, yeah.
Yeah.
It
Different
is two.
contributions.
Yeah.
Is this two?
I think it's one still.
That's
It's
the
so
one.
tough to see.
This is the Sural nerve. This one. See,
You
I'm
know-
gonna go down so you guys clearly know. Okay, that's the Sural nerve. I'm going down. See, do you see that? Because since you're, I think we are twisting your leg. That's the Sural nerve.
Yeah.
This one, right? This one. And I'm gonna come up. As you can see, come up here in the dark. Okay. This is the Sural nerve. And I'm gonna go up. See, you still see Sural nerve, right? Clearly,
Still one.
between the fat. And then still one, still one,
Beautiful.
still one.
Mm-hmm.
Still one.
Yeah.
Getting deeper.
Yes.
That one, good.
And what's that to the
That's
that's to the
the-
lateral
So
side?
this one?
Yeah, is that the two budding? Like
Do you
the
think that
one
that's the
medial-
two one? No, we didn't see the splitting part yet. Still Sural nerve is here to me in the middle. Can you point it out?
Right here?
Yeah, that's the Sural nerve we have. But what is the other one?
I don't know, is that a vein?
Vessel?
Now looks like it's merging. More cannot merge
Oh,
when we go
sorry.
up, right? Because it should split. Interesting. Maybe we make it a little deeper. Sural nerve, I see it here.
Right here.
Yeah, now we see clearly. See, going down. You see?
So
I
go a
go
little
fast. I
Yeah.
go fast.
It's like, yeah, perfect.
See?
Yeah.
So one, still one. Oh my God, we see very well now.
And if you go all the way down,
Yeah, yeah.
Oh my
see.
God, so beautiful. Look. I'm almost at the ankle. That's one. Okay, I'm
And
gonna
then
come
if
up.
you trace all the way approximately, which
Yeah, I'm
branch
gonna
is that
tra-
one coming off? Is that's coming off the tibial branch?
It has to be together because it's combined one, that one.
Look at it running. It's like swimming.
That looks like it's splitting right there.
Here?
Oh,
Here?
Yeah,
Here,
right
Yeah,
there.
here, see
Yeah.
two.
Yeah.
Boom,
Yeah.
boom, boom. So here, look at this. It's about
For
2/3 distal from the knee,
14
popliteal fossa.
centimeters?
So
That
this,
might be
this
14
is exactly
exactly.
14. Can you guys see it? This is exactly from the lateral malleolus
Yes, I would
to
say
the
that's right
knee.
You should have taken
About, yeah, let's measure. About from the lateral malleoli to probe is about 14, 20 centimeter.
Okay.
But now we know where Sural nerve of uncle.
It exists.
Yeah, it is existing. He can feel it. That's why he's ticklish, you know. It was
Record
here.
right over
yeah.
here and right there. That's where the
Oh my
active-
God, it's about 16 centimeter. So you are not abnormal. You're a normal person. So do you see? You guys see it on the
Yeah.
right side, dark? That's a sural nerve. So now my Gerard can show off when
Oh,
you go
there's
to
two?
EMG rotation.
Yep.
Yeah, that's exactly where we are.
Yeah, we have
Yeah.
two.
So where's the other one? One here.
One here, one here, right?
So let's
'Cause I saw it split.
freeze. Let me. I'm gonna go down again.
Yeah.
Now it's coming, I think. Here too. Here.
And then what's
Can
that
you
coming in
freeze?
up here? Is that something slipping into
Right
it?
here?
That I don't
Yeah,
know.
okay.
Yeah, that too. Here too. Here.
Yeah.
This
Right
is
here.
the two.
So that's really
Oh my
interesting.
God.
We, it almost looks like we have three slips.
Because
One,
this is
two,
slipping
three.
off. Yeah.
Then we have to track down. I don't know what that is.
Uh,
I don't know. I mean, I have to be honest.
that's because I think the variants are where the medial and the lateral communicate. Sometimes they communicate more proximally, more distally.
This is a common peroneal branches because I'm going to laterally.
Oh, you missed it, yeah.
Yeah, that one. I'm
And there it
moving
is,
to
there it is.
laterally. Looks like two here too.
No, it came from this side.
Oh, this is from the common peroneal nerve,
Yeah.
right? So here, here. Now I have like a carpal tunnel syndrome coming to my hand. Here,
Yeah.
here. Interesting. But if we go down continuously, here I think,
This one goes deep.
yeah. This is too. That's artery. I want to see.
Yeah, that's
That's
vascular.
artery. Yeah, that's vessels.
So
That's
is
not
it-
nerve. Maybe here is two and it goes deeply. One and two. Maybe splitting like this. Look at this. Do you see? Here, if I go down, it has to be one.
You agree nerves
Yeah.
still here.
See, one is moving continuously over there on the fat. Right? That's the together, right? Oh, not together yet, because look at this. Then where's the other one? The other one to be one. Here, two,
That's about where we were.
Yeah.
right? This is two. One, this is from the common peroneal. That's from common peroneal, what we were tracking down. The other one popped out, this one. And then, but we can be wrong. So we're gonna go, See here. Can you freeze this one? But, so if I understand correctly, this one looks like from the common peroneal nerve. This one look like tibial branches. And meeting here, which is, I was here.
Half
Like
two
about,
thirds.
yeah, lower than 2/3. But let's put this one here and try to figure it out. Where are we? Let's find out your sural nerve. It's now disappeared. Interesting. It's
No,
got one.
a little bit, yeah.
That one?
Yeah.
Oh, that one, we found it.
Yeah, it's pretty close to your.
It is.
Yeah, it is. You're
It's
right.
almost in the midline.
Yeah. See this one is we clearly know that's the sural nerve, right? Now I'm going up, I'm moving fast.
See, it just right there. There's a couple
Looks like
points right
we're-
there. I wonder if that's where you're
Look-
starting to see some contributions from the lateral side,
It looks like a two here.
or that's where that communicating branch
Only, look at this, only here one, I see one.
is. Yeah.
See, look, I'm gonna go down and then go down to the ankle.
And that little slip thing is driving me nuts.
Which one?
The top left one.
There could be some superficial branches maybe?
I don't. Yeah.
See, look at this. Now I'm going up, going up to the This is the lateral side to the fat. Now it's a very superficial sural nerve. Here, something comes up here.
This is what.
This is, don't you feel that there are another one?
This is a good teaching environment. We're all like, posing good questions.
Yeah, we have to.
This is discovery. This is
Discovery.
not easy. This is not easy.
Don't you feel that we have two nerves here? Look at this. Can you
It
phrase?
looks like two different
Yeah.
nerves.
Oh,
One,
you agree, right?
yeah.
Maybe you and I are saying
We
different
should show the
things, but
people back home.
so what I'm saying is, I see different. Oh no, don't move that one.
It's all in the back.
How is this
Keep going
one?
this way, yeah, there you go.
This one, when I see that, two. When I say two, 1 and 2,
Mhm.
it's coming now. That was here. It's the same place. But let's do it again until we get convinced each other. Okay, let's start from here. Now we know very well here, right?
Mhm.
Here you see nerve pops out. Here pop very clearly coming here,
Mhm.
right? Which is about 1 centimeter above the lateral malleoli.
That's where we record. So
Yeah.
that makes sense.
So we're gonna go up. I'm moving fast. I'm
And
moving
now
fast,
it's
but
like-
I'm moving to medially. My probe is moving to medially, going up.
I just saw a tiny little thing come off.
Yeah.
Now it's 2. Now merging, right? 2 and then split. Oh, down split it here. See? Oh, can you
Yeah.
freeze?
I think I see what you mean. Almost looks like two
Yeah,
two
please.
rims of sunglasses.
Yep.
Oh,
Yep. Sunglasses here. Now you're not touching. Cursor. I almost lost my sunglasses. But here, 1
yeah.
and 1.
Mhm.
This one was what we are tracking up. This one was popped out.
Mhm.
So they were merged below that, but now they're splitting. Do you agree?
Yeah.
So let me put the measures so people understand. This one,
We should see if we can get one of those presentations on Sural from the.
Yeah.
oh
You know, maybe we can bring that to the next session. The EMG fellows do presentations on all the nerves.
Oh,
They
really?
chime in. So I'll grab the one on Sural, and they can talk about variants and
Yeah.
incentives and stuff. We can have that
let's do it
discussion
together.
next week.
So here, unfreeze. So now we see Sural too much. Oh, but I think you are. I want to bother me. There's another similar one.
Yeah, right here.
Yeah, you agree with me, right?
Yeah.
But that's not one nerve.
No,
that's
no, no,
not
that's the
together.
back. Remember the thickened vascular
that?
information
Picture shows
shows
it
one of the
better on
veins?
YouTube than it does.
If you keep going down, keep going down, keep going down, keep going down.
Bringing it on the machine.
This is
Yeah,
one of the
smoother.
arteries,
I don't know what
the
that's about.
veins. See, you see how?
Yeah. That's fair.
That's
Looks
just
like
vascular.
why don't we do longitudinally? See
Yeah.
what happens. That's the tendon, right?
Yeah, that's the
That's the tendon.
Good luck with this.
It's gonna be tough.
This is Achilles tendon.
There's a
Tendon's
tendon
gonna
and a
take
cardiac
over.
pelvis.
Here, but if I do
Yeah.
transverse, immediately the round stuff
Yeah.
Yeah.
popping out, and then
It can be done, but
Say it again.
That's like all of them.
You're basically
You know-
doing like a block on your plantar nerves.
Yeah, it's pretty.
Yeah, because you're compressing the medial aspect.
you know the funny thing is like when I watch YouTube, I laugh too loudly. I should laugh like this.
Dr. Kim, the rate at which you are accruing subscribers, you have to laugh any way you want. Whatever you're doing is working.
Oh, really? See, look at this.
you
Look
should
at
just
this.
do this thing, AACPDM.
Look at this. Look at
Yeah.
this.
Yeah.
Mm-hmm.
It's not two yet.
Still one.
Yeah.
Okay. Still one. Yeah.
I feel like it right there it becomes very
Here.
difficult to
There's
observe.
two.
Here. That's exactly where we were.
Yeah.
Here. Oh, here clearly? let's follow the
Well, we
other
really
one.
we need another leg too.
We need another leg.
We do. We have to compare.
Oh, that's true. But this is a common perennial branch. You know, the thing what we are following is common perennial branch. See, look here.
Can you find where the superficial perennial comes out of?
I'm having fun, don't ask me. See,
What's
look.
also interesting is that's the same
See,
vein.
it's common
from-
perennial
It's
nerve.
gone.
What was it?
That was, go back to exactly where we were,
A little bit further down, yeah.
a little bit more distally.
So funny when we have a
Also-
school, we cannot
We
find
may
it.
have to go from back up and then come back.
Home base.
There we go.
So this
Uh-huh.
is the same exact vein that's tracking all the way up.
The
as
vein?
As
Vein?
Ankur noted, yeah. So this one,
So
go,
this is the
go
vein.
back more distally.
This is the vein. Look.
There you go.
So that's
See
a
this
small
one?
saphenous
Huh?
vein.
This one though, are we sure? Because
Yeah.
this is tracking
Yep.
all the way up to the popliteal fossa.
Yep, small saphenous vein. Goes
Yeah.
all the way, and
I
it
thought
falls.
saphenous comes off like
No,
medial
it's,
side.
that's the great. There's a great saphenous vein, there's a medial,
Oh.
and there's a small saphenous
Okay.
that runs right with the sural nerve.
Yeah.
So you see this?
That's
one?
a small saphenous.
Yeah,
That's cool.
But you
that's-
may
I
guys
never knew that
wanna
existed.
try.
And that's coming off the
Definitely.
popliteal.
I want to try it.
Yeah.
This is awesome.
At least this is cool.
This is so cool.
Yeah.
Yeah, because that tracks
This is
all,
how-
all
yeah.
the way with it.
Okay, let's do it.
The vein tracks with it.
You gotta give yourself a break time, Vicky.
Do you want a break, Oscar?
It's okay, I'm good.
Alright.
But we may not find out from other people.
It's true.
Let him
It
do
would take a
whatever.
while.
I'll do